Mechanism of diclofenac sodium, Nsaid, for pain management. Diclofenac sodium is a non-steroidal anti-inflammatory drug, Nsaid, commonly used in pain management. It works primarily by reducing inflammation, pain, and fever. Here's a detailed mechanism of how it functions. 1. Inhibition of cyclooxygenase, COX, enzymes COX-1 and COX-2 inhibition. Diclofenac sodium works by inhibiting the activity of cyclooxygenase enzymes, specifically COX-1 and COX-2. These enzymes are responsible for converting arachidonic acid, a fatty acid found in cell membranes, into prostaglandins, which are lipid compounds that play a crucial role in the inflammatory response. COX-1, present in most tissues, COX-1 is involved in the production of prostaglandins that maintain normal physiological functions, such as protecting the stomach lining and regulating renal blood flow. COX-2, this enzyme is primarily induced during inflammation and produces prostaglandins that mediate pain, swelling, and fever. Effect on prostaglandin production: by inhibiting COX enzymes, diclofenac reduces the synthesis of prostaglandins, which are responsible for causing pain, fever, and inflammation. This reduces the inflammatory response, thereby alleviating pain. 2. Anti-inflammatory action: reduction in swelling. The reduced production of prostaglandins, especially prostaglandin E2, decreases blood vessel dilation and the permeability of capillaries, which prevents fluid from accumulating in tissues and causing swelling. Reduction in inflammatory mediators: in addition to prostaglandins, COX inhibition may reduce the release of other pro-inflammatory mediators like bradykinin and cytokines, which play a role in amplifying pain and inflammation. 3. Analgesic effect: pain relief. The reduction in prostaglandins directly lowers the sensation of pain, particularly nociceptive pain caused by inflammation. This makes diclofenac effective in conditions like osteoarthritis, rheumatoid arthritis, and post-traumatic pain. Central effects: some evidence suggests diclofenac may have additional central analgesic effects through modulation of the central nervous system, although this is secondary to its peripheral anti-inflammatory action. 4. Antipyretic action: fever reduction. Prostaglandins, particularly PG2, are involved in elevating the body's set point temperature in the hypothalamus, leading to fever. By inhibiting prostaglandin production, diclofenac can lower fever. 5. Effect on platelet aggregation: minor. Unlike some other Nsaids like aspirin, diclofenac has a relatively mild effect on platelet aggregation. This means it does not increase bleeding risk as significantly as drugs like aspirin, but it still can inhibit platelet function to a minor extent. Disclaimer: this channel does not promote or encourage any illegal activities, and all contents provided by this channel are meant for educational purposes only. Any copyrighted material on these slides is included as fair use for educational purposes only. It will be removed at the request of copyright owners.